My topic is on immunity and immunization. I'm Dr. Jennifer Niles. A solid foundation in immunity and immunization is essential for medical students, as they will encounter these concepts throughout their clinical practice and interactions with patients. It is important to foster a comprehensive understanding of how vaccines work, their benefits, and the role they play in public health. These are the learning objectives. 1, to have an understanding of the immune system, to know the different types of immunity, differentiate between active and passive immunity, understand the difference between natural and acquired immunity, know the concept of herd immunity and its importance in preventing outbreaks, to learn immunization basics, define immunization and its role in preventing infectious diseases. Number 4 is to learn about vaccine types, to recognize different types of vaccines, such as live attenuated, inactivated, subunit, and conjugate vaccines, to be familiar with some milestones and challenges of the government's immunization program, to be familiar with the evolution of vaccine introduction in the country, to be familiar with common vaccine preventable diseases, including their symptoms, transmission, and potential complications, to learn about the recommended vaccination schedule for pediatric age groups and other populations, to understand the routes of vaccine administration, example, intramuscular, subcutaneous, and intradermal, and the importance of proper technique. Number 7, to understand the vaccine safety and adverse events, to be aware of the common vaccine-related adverse events such as mild fever or local reactions. And number 8, to determine the current and emerging vaccines, to give you an update on new vaccines being developed and approved for various diseases. An understanding of immunization entails a basic knowledge of immunity. So what is immunity? It's the ability of the body to tolerate the presence of material indigenous to the body or self and to eliminate foreign materials or non-self. Let's go to antigen. What is the material we are referring to in the previous slide? They are called antigens. Antigens exist on viruses, bacteria, allergens, parasites, proteins, tumor cells, and normal cells in your own body. You might hear your own body's antigens referred to as self and viruses, bacteria and other harmful antigens referred to as non-self. This means that your body recognizes your own cells as you, but other antigens as intruders. But for our lecture, we will tackle those involving antigens in viruses and bacteria. Antigens are usually proteins or sugars or polysaccharides, a term you usually hear in biochemistry, found on the outside of things like cells or viruses. Each has a unique shape that your immune system reads like a name tag to know whether it belongs in your body. What happens when an antigen enters your body? Your body defends itself against harmful antigens with chemicals called antibodies. When an antigen enters your body, the B cells of your immune system inspect it. B cells have special parts or receptors that test the antigen to see if they fit together like a lock and key. If it's a fit, the B cell makes chemicals called antibodies that all have the same shape to recognize the antigen. An antibody's job is to find antigens that fit the specific shape on their surface. Antibodies lock on or bind to antigens so that your immune system can destroy them. Once your immune system has seen an antigen, It has special cells that remember it, allowing your body to create a faster and more effective response if it invades again, and this is called immunological memory. Antigens are markers that tell your body that something is foreign. Your immune cells make antibodies to recognize and destroy harmful antigens. In fact, you can think of antigens as antibody generators. Antibodies are very specific to the antigens they recognize and destroy. They fit onto the antigen like a key to a lock. There are several types of antigens categorized where they come from. These include exogenous antigens, endogenous antigens, autoantigens, and tumor antigens. For this purpose, we will be talking mostly about exogenous antigen. How vaccines help? Vaccines contain the weakened or inactive parts of a particular organism or antigen that triggers an immune response within the body. Newer vaccines contain the blueprint for producing antigens rather than the antigen itself. Regardless of whether the vaccine is made up of the antigen itself or the blueprint so that the body will produce the antigen, this weakened version will not cause the disease in the person receiving the vaccine, but it will prompt the immune system to respond much as it would have on its first reaction to the actual pathogen. All vaccines contain an active component or the antigen, which generates an immune response, or the blueprint for making the active component. The antigen may be a small part of the disease-causing organism like a protein or sugar, or it may be the whole organism in a weakened or inactive form. There are two types of immunity, active and passive. Active is produced by the body following exposure to antigens, and passive immunity is acquired without challenging the immune system with an antigen. In addition, we have natural and acquired immunity. Natural immunity occurs through contact with a disease-causing agent. Artificial immunity develops through deliberate actions of exposure. Naturally acquired active immunity develops on exposure to a pathogen, leading to subclinical or clinical infection that results in a protective immune response against future exposure to the pathogen, as when one develops a mild or moderate infection on exposure to person infected with the COVID-19 virus. Artificially acquired active immunity is via administration of vaccines containing live or dead pathogens or their active components, as when one develops immunity after receiving the COVID-19 vaccine. Naturally acquired passive immunity is immunity transferred from the mother to the fetus through placental IgG or colostral IgA transfer of antibodies, as in perinatal transmission of hepatitis B or congenital rubella syndrome. Artificially acquired passive immunity is immunity transferred by injection of human or animal-derived gamma globulins as used in many acute infection situations, example tetanus, rabies, varicella, or use of antitoxins for dirty wounds or snake bites. Artificially acquired active and passive immunity constitutes immunization. What is active immunization? It is the administration of all or part of a microorganism or a modified product of that microorganism, example toxoid, to evoke an immunologic response, meaning mimicking that of the natural infection that presents little or no risk to the recipient. The types of vaccines are either live, attenuated, or killed or inactivated. So this is a summary of the differences between the live attenuated or killed inactivated. So live attenuated or weakened form of the wild virus or bacteria. It retains its ability to replicate and can produce immunity with a single dose. But this is affected by circulating antibodies to the antigen. However, in the killed inactivated, the particles are destroyed and therefore cannot replicate or divide, but still retain some integrity to be recognized by the immune system. And because they cannot reproduce, booster shots are required periodically to reinforce the immune response. These are examples of live attenuated and killed inactivated vaccines. For live attenuated, the viral vaccines are measles, mumps, rubella, varicella, oral polio, and rotavirus. And the bacterial vaccines are BCG and oral typhoid. For killed inactivated, we have whole cell or part of the cell. Under the whole cell, the killed bacterial vaccines are whole cell pertussis, typhoid, and cholera. And the killed viral vaccines are inactivated polio, hepatitis A, rabies, and influenza. Fractional means it is prepared from fractions of the cell, example from pieces of bacteria or viruses, which are proteins that stimulate the production of T lymphocytes and antibodies that will help the body remember how to fight the bacteria or the virus if one gets infected in the future. Polysaccharide is made from pieces of the polysaccharide capsule that surround certain bacteria, as is typified by pneumococcal and meningococcal vaccine. Conjugate polysaccharide vaccines contain polysaccharide that is chemically linked to a protein carrier, maybe diphtheria toxoid, which serves to improve the immunogenicity of the polysaccharide. This linkage makes the polysaccharide a much more potent vaccine, which is why polysaccharide conjugate vaccines are much more widely used. Haemophilus influenza type B vaccine is an example. The other types of killed COVID-19 vaccines are mRNA and viral vector vaccines. mRNA or nucleic acid-based vaccine contain genetic material from the virus that causes COVID-19 that instructs our cells to make harmless protein that is unique to the virus. This stimulates an immune response leading to the production of T lymphocytes and B lymphocytes that will remember how to fight the virus if we are infected in the future. A viral vector vaccine contains a modified version of a different virus other than the one that causes COVID-19. Inside the shell of the modified virus, there is a material from the virus that causes COVID-19. This is called a viral vector. So once the viral vector is inside our cells, the genetic material gives cells instructions to make a protein that is unique to the virus that causes COVID-19. Using these instructions, our cells make copies of the protein. This prompts our bodies to build T lymphocytes and B lymphocytes that will remember how to fight the virus if we are infected in the future. Passive immunization and immunotherapy are particularly helpful for individuals who are immunocompromised and therefore cannot mount their own immune response. Passive immunization also works quickly, providing protection within hours or days, whereas vaccines can take weeks or months if boosting or more than one injection is required. Unlike vaccination, however, passive immunization and immunotherapy do not result in immunological memory. Also, the transfer of antibodies from animals or other people can cause side effects, including severe allergic reactions. So these are the product types. Human immune globulin, which is derived from pooled plasma of adults, consists primarily of IgG and traces of IgA and IgM. It is used as replacement therapy in AB deficiency disorders, hepatitis A prophylaxis, measles prophylaxis. Number 2, specific immunoglobulin, which is also used in some post-exposure situations but specific for the particular disease condition when time does not permit adequate protection by active immunization alone. Examples are hepatitis B immunoglobulin, rabies immunoglobulin, tetanus immunoglobulin, and varicella zoster immunoglobulin. Number 3 is human intravenous immunoglobulin. It is used as replacement therapy in antibody deficiency disorders, idiopathic thrombocytopenic purpura, Kawasaki disease, premature infants, and AIDS. And number 4 is human plasma. This is used among burn patients to control Pseudomonas infections, patients with protein-losing enteropathy, COVID cases from patients who recovered from COVID-19. And number 5 are antibodies of animal origin like tetanus, anti-rabies, snake bites, and spider bites, or anti-venom. Let's now go to immunization. So what is immunization? It's the provision of an individual with specific protection to destroy or inactivate the disease-producing agent or to neutralize its toxins. The immediate goal is prevention of the disease, and the ultimate goal is eradication of the disease. The next slide is the National Immunization Program, which I got from the website of the Department of Health. So the overall goal of this program is to reduce the morbidity and mortality among children against the most common vaccine-preventable diseases. These are their specific goals: to immunize all infants or children against the most common preventable diseases, to sustain the polio-free status of the Philippines, to eliminate measles infection, to eliminate maternal and neonatal tetanus, to control diphtheria, pertussis, hepatitis B, and German measles, to prevent extrapulmonary tuberculosis among children. In September 1976, under Presidential Decree 996, the expanded program for immunization was launched, which provided compulsory immunization for infants and children below 8 years. When the program was first rolled out in 1979, 6 vaccine-preventable diseases were included. These were tuberculosis, diphtheria, tetanus, pertussis, poliomyelitis, and measles. In 1992, hepatitis B was included. By 2010, measles, mumps, and rubella, or MMR, and pentavalent vaccine composed of 5 vaccines, diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenzae type B, were introduced. In 2011, the Mandatory Infants and Children Health Immunization Act, or RA 10152, was signed into law by then-President Noynoy Aquino, requiring all children under 5 years old to be given basic immunization against 10 vaccine-preventable diseases. tuberculosis, diphtheria, tetanus, and pertussis, poliomyelitis, measles, mumps, rubella or German measles, hepatitis B, Haemophilus influenzae type B or HIB. In 2012, rotavirus was introduced into the National Immunization Program, prioritizing the infants of families listed under the National Housing and Targeting System for poverty reduction nationwide, as well as the introduction of flu and pneumococcal polysaccharide vaccine for indigent senior citizens. In 2013, pneumococcal conjugate vaccine was introduced in ARMM and Caraga and were the first beneficiaries of the program. In addition, measles and rubella plus booster doses of diphtheria and tetanus were given to high school students initially and later on to grades 1 and 7 public school students under the school-based immunization program. Inactivated polio vaccine was added in 2014. By 2015, 9 to 10 years old in 20 of the poorest provinces in the country were prioritized to be given human papillomavirus vaccine. In April 4, 2016, the DOH with DepEd and DILG launched administration of dengue vaccines in Marikina City and in 3 regions by 2017 to children aged 9 to 10 years old but subsequently suspended. Japanese encephalitis virus vaccine was introduced to regions 1, Ilocos, 2, Cagayan Valley, and 3, Central Luzon, and Cordillera Autonomous Region or CAR in March 2019. Also, the use of cholera vaccine for high-risk exposure groups and during outbreaks. And currently, the ongoing COVID-19 vaccine rollout to priority groups in the country started in 2021. An immunization schedule from the government's immunization program is list of vaccinations recommended at a particular age, bearing the type of vaccine, route, frequency of administration. It starts with a single dose of BCG given intradermally at birth. BCG gives protection from tuberculosis and it has to be given at birth. So tuberculosis is an infection that most often attacks the lungs. In infants and young children, it affects other parts of the body like brain, bones, joints, and other internal organs. So we call that extrapulmonary or miliary tuberculosis. A severe case could cause serious complications or death. The BCG vaccination has a protective effect against meningitis and disseminated TB in children. TB is very difficult to treat when contracted, and treatment is lengthy and not always successful. According to the 2020 World Health Organization Global TB Report, the Philippines has the highest TB incidence rate in Asia with 554 cases for every 100,000 Filipinos. I'm going to show you how to do an intradermal injection, which is the route of administration for a BCG vaccine.
A baby. Giving an intradermal injection correctly takes practice and patience because you are injecting the vaccine into the very thin skin layer. Wrap the baby well to reduce his movements. Clean the site with clean water. Stretch the skin and hold it firmly. Lay the needle and syringe almost flat along the baby's arm with the opening in the needle facing up. Insert the tip into the skin. Advance it just past the opening of the needle. Gently point the needle upward without re-piercing the skin. Now, inject the vaccine slowly and steadily. You can stabilize the needle with your thumb. You'll notice it's hard to push the fluid in. You should see the skin turning white and raising a small bump.
Okay, the next vaccine is a single dose of monovalent hepatitis B given intramuscularly at birth. So note here that there are two vaccines that are given at birth. So what is hepatitis B? Given the vaccine, you are protected from the hepatitis B infection. And hepatitis B virus is a dangerous liver infection that when caught as an infant, it often shows no symptoms for decades. It can develop into cirrhosis and liver cancer later in life. So children less than 6 years old who become infected with the hepatitis B virus are the most likely to develop chronic infections. So this slide, I will also show you how to do an IM injection. If you're going to do an IM injection, make sure that the patient is seated.
There, and I'm going to feel a couple of finger breaths below that. And then I've got my little triangle here, okay? All right.
Don't miss me.
All right.
Oh, no.
All right.
Big bad dude.
All right. So again, I've got my bone, my two fingers, and here's my triangle, okay? Now, depending on what your textbook looks like and what your facility policy looks like, you might want to draw this taut. And some places are teaching you to pinch it up. That's not accepted practice yet. So I've just drawn it taut, okay? And I'm gonna hold it here. And then I'm gonna go in at a 90-degree angle like a dart. And I'm going to inject.
Okay. So that's how to do IM injection. So the next vaccine that will be given a child is the pentavalent vaccine. So these 3 doses of pentavalent vaccine containing DPT or diphtheria, pertussis, tetanus, H. influenzae type B, and hepatitis B are given intramuscularly at monthly intervals beginning by 1.5 months of age or at 6 weeks, 10 weeks, and 14 weeks of age. So what does it provide, the pentavalent vaccine? So the child is protected against diphtheria, and diphtheria infects the nose, throat, tonsils, and or skin. The diphtheria toxin may cause obstructive pseudomembranes in the upper respiratory tract, making it hard for children to breathe and swallow. So severe cases can cause paralysis, heart failure, kidney failure, and sometimes death. Pertussis or whooping cough causes coughing spells that can last for weeks. In some cases, it can lead to troubled breathing, pneumonia, and death. Tetanus causes very painful muscle contractions. It can cause children's neck and jaw muscles to lock or lock jaw, making it hard for them to open their mouth, swallow, breastfeed, or breathe. Even with treatment, tetanus is often fatal. And lastly, the Influenza type B causes death and serious disease from meningitis and pneumonia in infants and young children. So Hib bacteria are carried in the human nasopharynx, from where they can be transmitted to other humans via droplets from nasopharyngeal secretions. And lastly, the Hep B. 80 to 90% of infants infected with hepatitis B during the first year of life are most likely to develop chronic infection. So this is a sound of a whooping cough among children and adults. Okay. So we talked about pertussis in the previous slide. So this is caused by the bacterium Bordetella pertussis, which is transmitted through the coughs and sneezes of an infected person. And tetanus, an infection caused by Clostridium tetani. So the bacteria is commonly found in soil, saliva, dust, and manure, and enters through a break in the skin to produce toxins that result in muscle spasm. And Hib causes bacteremia, pneumonia, epiglottitis, septic arthritis, cellulitis, otitis media, and acute bacterial meningitis. Transmission occurs through direct contact with respiratory droplets from nasopharyngeal carrier or case patient. So the next vaccine includes 3 doses of oral polio vaccine given at 6, 10, and 14 weeks of age, and a single dose of inactivated polio vaccine given intramuscularly with the 3rd dose of the oral polio vaccine at 14 weeks. So the poliomyelitis is caused by the poliovirus that spread from person to person through food or water infected by fecal matter. It is characterized by muscle weakness resulting in an ability to move. So the polio vaccine protects person from developing polio, and the virus paralyzes 1 in 200 people who get infected. And among these cases, 5 to 10% die when their breathing muscles are paralyzed. There is no cure for polio once the paralysis sets in. Okay. So we now go to the 3 doses of pneumococcal conjugate vaccine given intramuscularly at 6, 10, and 14 weeks of age. So the vaccine, the PCV vaccine, prevent pneumonia and meningitis caused by Streptococcus pneumoniae. So pneumococcal diseases such as pneumonia and meningitis are common cause of sickness and death worldwide, especially among young children under 2 years old. If you're interested, you can look at our article which we wrote about the cost effectiveness of the 13-valent PCV versus the lower valent alternatives in Filipino infants. The next vaccine is the MMR and the measles. So it is given measles containing vaccine either as monovalent measles vaccine or combined with mumps or rubella. Can be given subcutaneously at 9 months and 1 year of age. So we know that measles is a highly contagious disease with symptoms that include fever, runny nose, white spots in the back of the mouth, and a rash. Most common complications are ear infection, diarrhea, and pneumonia. Serious cases can cause blindness, brain swelling, and death. On the other hand, mumps can cause headache, malaise, fever, and swollen salivary glands. Complications can include meningitis, inflammation of testicles, and deafness. Rubella infection in children and adults is usually mild, but in pregnant women, it can cause miscarriage, stillbirth, infant death, or birth defects in the eyes, ears, heart, and brain, which we call congenital rubella syndrome. So this is measles, caused by the measles virus via airborne spread through coughs and sneezes of those infected. So Koplik spots are the peculiar spots present on the buccal mucosa and are considered a diagnostic or pathognomonic feature of measles in the pre-eruptive stage. Small white spots may appear inside the cheeks and on the back of the lips a few days later. These spots usually last a few days. So this is mumps, which is a viral disease caused by the mumps virus that is transmitted by respiratory droplets or direct contact with an infected person. It is characterized by painful swelling of one or both parotid salivary glands. And rubella is caused by the rubella virus that spreads through the air via coughs of people who are infected. It is typified by a rash which starts on the face and spreads to the rest of the body and lasts for 3 days. So I will now show you how to do a subcutaneous injection.
We're going to measure from the middle of the elbow, the middle of the back of the shoulder, about 3/4 of the way up. We're going to pinch about an inch. Take the cap off. Grab that. We're going to hold it at a 45-degree angle. Make sure their arm is relaxed. The bevel is up. We're going to pinch middle of the elbow up. Double check again. Pinch about an inch. Aspirate. You don't have to, but we're just going to do it.
Okay.
We're going to measure.
So the next vaccine is so these essentially are the vaccines before 1 year of age. Before 1 year of age. So 1 BCG vaccine, 3 doses of Hep B, 3 doses of DPT with and then 3 doses of influenza B, oral polio vaccine, 3 doses, 1 dose of inactivated polio vaccine, PCV, and measles and MMR. So this is the summary of the vaccine, the minimum age at first dose, the number of doses, the minimum interval between doses, and what the vaccine does to the child. So BCG is given at birth or anytime after birth, 1 dose. It really just protects the infant from the possibility of TB, meningitis, and other TB infections. Hepatitis B vaccine, also given at birth, 1 dose, reduces the chances of being infected and becoming a carrier of hepatitis B. The pentavalent vaccine, which comprises 5 vaccines, the DPT, the Hep B, and the Hib. So the minimum age at first dose is at 6 weeks. There are 3 doses, and the minimum interval between doses is 4 weeks or 1 month. So it protects against the 5 diseases. The oral polio vaccine, or the OPV, and the inactivated polio vaccine, the minimum age is, first dose is at 6 weeks. The number of doses are OPV 3 doses, IPV 1 dose, and the minimum interval between doses is 4 weeks or 1 month. So it protects against polio diseases. So rotavirus vaccine given at 6 weeks of age. There are 2 doses given a minimum interval of 4 weeks or 1 month between doses. It protects against diarrhea caused by severe forms of rotavirus diseases. Measles is given at 9 months, just 1 dose, and prevents death, malnutrition, and protection from measles. And the combination of measles, mumps, rubella vaccine is given at 1 year and 1 month. It's 1 dose, and the protection is against the measles, mumps, and rubella virus. So this is the cold chain, a summary of the vaccine cold chain, which is a system for storing vaccines in good condition, composed of a series of links designed to keep vaccines within the WHO recommended temperature ranges of +2 degrees centigrade to +8 degrees centigrade for most vaccines, from the point of manufacture to the point of administration, to maintain product quality. So for COVID-19 vaccines, this would require refrigeration with temperature that ranges from +2 degrees centigrade to +8 degrees centigrade refrigerated, or -15 degrees centigrade to -24 degrees centigrade frozen, and to as low as -70 degrees centigrade to -80 degrees centigrade, or we call an ultra cold. So this is a childhood immunization schedule 2023 from the Philippine Pediatric Infectious Disease Society of the Philippines and Philippine Foundation for Vaccination and Philippine Pediatric Society. So this is just nice to know, so you can refer to this immunization schedule. And the next slide is that vaccines are not just for children, but adults can be protected from the deadly diseases as well. So in the adult immunization schedule, we see similarities with vaccines given in the pre-adolescent and adolescent age groups, such as Tdap, tetanus, diphtheria, and acellular pertussis, Hep A and Hep B, MMR, varicella, and HPV. Because of a relative immunocompromised state associated with aging, so vaccination against influenza, pneumococcal disease, and shingles, or herpes zoster, become essential. So, and more importantly, COVID-19 vaccine. And for high-risk groups, to include vaccination for meningococcal, cholera, rabies, and typhoid. So what are the side effects associated with vaccination? So there's local side effect. So there's pain in the injection site, there's redness, or maybe swelling at the injection site. So there can also be systemic side effects, which comprise with symptoms like fever and body malaise. So what are the general immunization practice? So we have permanent contraindications to vaccination. So if you develop severe allergic reaction or anaphylaxis during the shot, that you were given initially, you should not get the second shot anymore. Encephalopathy within 7 days of a previous dose of diphtheria and tetanus toxoid and whole cell pertussis, if you're severely immunocompromised, and pregnant women. So what are the benefits of immunization? So it protects the individual. It also protects the communities. How do you protect the community? So when a sufficient percentage of population has become immune to an infection, whether through vaccination or previous infections, the likelihood of infection for individuals who lack immunity is thereby reduced. So we can eradicate the disease and because we can eradicate the disease, we will have positive health economics. So even if you're vaccinated, doing it all protects us all. So we still practice cough etiquette. We wear masks, hand hygiene, going to not so crowded places, and maintaining social distancing. So what are the current and emerging vaccines that are being developed in the market? So there are COVID-19 vaccines that are being developed. There's a combination of COVID-19 and influenza, and other viruses are being developed as well for other viruses, as well as for bacteria, for protozoan, and some other agents. So who can vaccinate? Vaccines can be administered by any duly licensed physician, nurse, or midwife. So you encountered Republic Act number 10152, which is an act providing for the mandatory basic immunization services for infants and children, repealing for the purpose Presidential Decree number 996 as amended. So pharmacists can also vaccinate as well as they are certified. So I'd like to acknowledge Dr. Penny Adversario, a co-faculty from the Department of Preventive and Community Medicine, for her slides on immunity and immunization. So it's clear that prevention will never be sufficient. That's why we need a vaccine that will be safe. So it's a quote by Luc Montagnier, a microbiologist. And you protect yourself, you protect others by getting vaccinated. And we all have a role to play to ensure everyone can get the vaccines they need. A quote from Sibylla Kilichi, Executive Director of Vaccines Europe. And thank you for listening.